Yes. Can everyone hear me that way? Yeah. Good morning, everyone. I'm sorry that I didn't join from the very beginning of the conference, but we had a training in Germany for about 50 libertarian students from all over Europe to make them multiplicators. In their countries, I think we had 29 different countries represented to grow the pro-liberty student movement. That's why I was late yesterday. So I have some time to talk about free market healthcare findings or reforms in Eastern Europe. Um, Definitely, Eastern Europe had to undergo a very large transition in the last 20 to 25 years. And it could be observed that the health system and education system are usually the last two sectors of an economy slash society where the transitioning from planned economy to market economy actually takes place. That's also connected, especially for those Eastern European countries which joined the EU in 2004 or 2007. And now we have also, I think, in 2013 one, like with Croatia, new member of the happy family. And usually reforms in the health system are not part of the coherence criteria. So these criteria you have to, I don't know, it's often like reforms in the financial sector and privatization of some economies or industry sectors, but the health system is usually not part of these necessary reforms before you can access the club of happy EU countries. So that's why that's one of the reasons why the health system was, or health systems in most of the Eastern European economies, post-communist countries, was not really, didn't really undergo such a transitioning as most other parts of the economy. And to be honest, most Eastern European countries still have a very centrally planned health system. But if you even look at Western Europe, most countries, let's say except the Netherlands and Switzerland, have heavily centrally planned health systems. Some more, some less. In Germany, at least, you have private provision of healthcare, but it's publicly paid. In the UK, you just have the nightmare of every libertarian. So it's we should like be very humble when I talk as a German about health systems in post-communist countries. Healthcare in most countries around the world is pretty much still in the centrally planned sector, or even in some parts on the march to be more centrally planned. If you look at the US, where they have kind of a social democratization of their health system going on. So anyway, there are a couple of really interesting examples in Eastern Europe what privatization and deregulation of healthcare achieved. And I would like to highlight those because they are also interesting for people from Western countries to get really good ammunition for arguments why we need more markets in healthcare, why people benefit from more markets in healthcare. And there are only very few positive examples around the world because not so many countries have actually tried to liberalize healthcare. So Switzerland is usually one of the okay examples one can come up with, but it's also not the perfect libertarian healthcare utopia. Singapore works partially, but like a lot of the healthcare provision, Singapore is actually owned by the state. I think half of the hospitals are state-owned, so it's also not, I mean, that's not our vision for the world, right? Just have like half of the provision of healthcare being like owned or directly owned by the government. So it's always good to find more case studies in the world we can use for our arguments. And cherry picking is often necessary because you have often like one part of a reform which led to like very good results, but the rest of the reform was pretty bad. So let's say, oh, they're really good in funding healthcare privately, but they're really bad in providing actually good private care to people because it's like something that's regulated. Or the drug prices are heavily regulated, or drug companies are pretty good lobbyists. Let's say in the US, where prescription drugs cost ridiculous high amounts. If you want to get some antibiotics, you pay something like 10 times more than a European country, but it's like the same product. And that's also not what you can call a free market price or a price which is created on the market. It's done by regulators and successful lobbyists. They're pretty good entrepreneurs in these fields. So that's why I think we have to cherry pick different parts of the health sectors in countries which work much closer to what we envision for our lives and for the world we would like to live in. So I would like to start with Romania. Romania is like a terrible example, and I would like to start with it. I think we also have Romanians in here, so if I forget to mention something, please feel free in the Q&A to edit. Romania has a state-owned health system. You have state health insurance. Everyone is somehow part of it. I think it's currently taxpayer funded. I think they changed the funding a couple of times, either through payroll contributions or taxes. But at the end, it's more or less the same. Hospitals are mainly state-owned. Healthcare is for free. The only problem is to access healthcare is pretty hard because there's not so much healthcare, but it's for free. Probably the British people here also are aware of this problem. When healthcare is for free, usually it's pretty hard to get it. It's like when you have an open bar event, but there's only a 2-liter keg of beer. This open bar, it's hard to access the beer, but it's for free. Maybe we all just take little beer shots because then everyone gets a little of free beer. So that's a bit the problem when you have this healthcare is for free. There's no price mechanism which actually allocates the resources in a good way and also helps to have a good match with supply and demand. It's pretty simple economics, no rocket science. But the problem is if it's for free, usually healthcare is heavily rationed because it's totally underfunded. They probably have just a quarter the money in the system they would actually need to sufficiently provide the population with services. Doctors earn something like 100 or 200 euros officially per month. You cannot really live from that money, also not in Eastern Europe. So basically what happens is that you have informal payments. So if you actually want to get this free healthcare, you have to pay a little, as the Greeks call it, fakelaki. So basically, fakelaki is basically the entrance fee for the free healthcare. So you have basically doctors have to charge this illegal informal payments because otherwise they cannot survive and they would not work in the health system. So and that happens like not only in Romania but also in Ukraine and other Eastern European countries. So basically you have to buy yourself in. You have to bribe a doctor that he treats you in many cases. I mean, I don't say that all doctors are corrupt, but it's just like many people in the system are corrupt, and usually you have to pay out of your pocket for these services. The problem is of this informal payments, which are de facto co-payments. Problem is you cannot insure yourself against for informal payments. You cannot go to your insurance and say, oh, I bribed my doctor, can you please reimburse me? You know, I have like my deductible of 200 euro bribes and the rest is like paid by the insurance. This doesn't really work. That's already the problem if you have black markets, and it's basically de facto a black healthcare market. You cannot insure yourself. You have an intransparent price system. If the doctor sees he's the only guy who can help you, or you don't know where to find another good doctor, he can charge whatever he wants to charge you. You don't have the bargaining power of insurance companies. If you would have an insurance company which would take care of co-payments, they would have a preferred provider network or something like this, and they say, we send all our assured to this clinic and we get a 40% discount. That's not possible if you have patients paying bribes because you don't have the bargaining power on the demand side. So it makes it more expensive for patients, good for doctors because they don't have to face any procurement efforts, healthcare procurement, like no synergies in procurement from the patient side, from the demand side. So, and I think if we talk about humanistic elements, the worst problem of informal payments is that, let's say you have a car accident, you are out of conscious, they have to get you in the emergency room, and you would know if you would actually be able to bribe them. They would like use some better tools, or the head physician would come and actually treat you. But since you're out of conscious and you don't have the bribe insurance card they can like swipe, you don't get the super treatment, or at least you might not get it. So especially in emergency cases, these informal payments are not the best solution. So some countries have tried to legalize these informal payments. The Czech Republic, for instance, they legalized in hospitals that hospitals are allowed to charge, also state-owned hospitals, so they're allowed to charge patients extra money. That's up to them how much they want to charge. I think there are some limits, but they acknowledged, okay, we have this problem, we also have a funding problem, we actually don't have the money to provide sufficient healthcare, we have to ration a lot, so let's just acknowledge that there are these problems and let's legalize informal payments, and then people can buy insurance for it, just like white markets are much more efficient than black markets, especially for the patients. So if you're in an argument with someone and he says, oh, you libertarians, you don't care about people. No, if you want to have this free universal healthcare for everyone, you don't care about people, because people suffer a lot because these universal health systems do not work, as you can see. And then people are in the situation that they have to deal with corrupt doctors which ask for bribes, and you as a patient, you're basically always the weaker side in this relationship. So I think that's a really good argument why, for instance, informal payments should be legalized, because they are there anyway. So what's really interesting, I did like a little analysis of Romania. A lot of private hospitals popped up in Romania because the state health system is so bad that everyone who can somehow afford it wants to go to a private hospital. So especially in the field of maternity clinics, a lot of happens because people are like, okay, I want to give birth to my child in a nice environment. That's something we are eager to like pay money for. So I compared some data from Romania about the average. They were like polls about the average bribe you pay in a state hospital when you give birth to a child. Okay? And I compared it with these 5-star luxury maternity clinics, what you pay there in a like luxury room with a plasma screen and 2 nurses which take care of, or midwives which take care of you all the time. And actually, it's cheaper to go to these really, really nice fancy clinics like Regina Mare, how they're called, than actually going to a state-owned hospital paying the bribes. So, I mean, that's the absurdity, because this informal system is so inefficient that you actually can go to like a private hospital and pay, get much better services for it. So that shows the absurdity of this state-owned system. So the free system is actually more expensive than the private nice system. And I tell you, like, a state-owned Romanian maternity unit is not really where you want to give birth to a child. I mean, I can only say that as a man, but I would not do it. So that about Romania, okay? It's just like to see the absurdities of this centrally planned healthcare and what it leads. The only good thing I would say in Romania is that they at least allow people and also companies to provide private healthcare, that this is not outlawed. Some provinces in Canada, for instance, where you have also state healthcare, these provinces do not allow private healthcare at all. So, you know, like in the UK, for instance, and some other countries, you just say, okay, I pay my taxes, they fund the really bad health system with it. But when I get sick, I just pay out of pocket and go like to some private doctor or private hospital. In some countries, this is not possible, especially Canada. I mean, this is like a first world country, but when you get seriously sick, you have problems. So in that case, actually, I would prefer to be sick in Romania than in Canada, because you at least can buy private healthcare. You can buy private insurance, because that's like something in Canada which is absolutely not possible, at least in most provinces. And things are hopefully changing in the future. So Slovakia is another interesting example. The general health system in Slovakia is kind of okay-ish, looks more like a Central European health system with like payroll funded kind of statutory health insurances, which used to be actually private for some time, and then they got nationalized. Now they're about to get privatized again. So it's like a bit back and forth, because Slovakia always has these terms of 4 years free market reforms, and then 4-year evil dictator, and then 4-year free market reforms. I'm exaggerating, but Slovakia has kind of this interesting reform dynamics. So in 2006, the government in Slovakia allowed pharmacy chains. So in a lot of European countries, pharmacy chains are not allowed. Germany is the leading example, where only pharmacists are allowed to own pharmacies, and maximum 4 of them. Because otherwise you go too big, and all like underperforming pharmacists would actually go out of business. And the Guild of Pharmacists is pretty good in making sure that no one goes out of business. So maximum 4 pharmacies. It's a bit like, I don't know, communist times where you're allowed to have like maximum, I don't know, 1 acre of land or something. Everything else has to be a kolkhoz. So that's basically many European countries actually the case in the pharmacy market. So 2006, Slovak government liberalizes the pharmacy market, And actually, what happens usually is when you have these talks about liberalizing pharmacies, leftists say, or pharmacy lobbyists which are interested in small family-owned pharmacies say, no, that's really bad. If you liberalize the pharmacy market, and if you get pharmacy chains, what's going to happen is that a lot of small pharmacies are closing down. In villages, you won't have pharmacies anymore. It's only like in big cities where you have pharmacies. Yeah, and it's only the big pharmacies. Yeah. So people have to walk much longer to get to their pharmacy. Okay, let's see what happened in Slovakia. Okay, they liberalized the pharmacy market. 24 months later, the number of pharmacies in the countries was like 40% higher than during regulated times. Yeah? So they didn't close pharmacies, they actually opened a lot of pharmacies. Cost of doing business was much lower, it was much easier to run pharmacies. You had a lot of economies of scale while having pharmacy chains, so they could actually afford to open pharmacies where it was not profitable before. And the same happened in Sweden, where they had like a government monopoly on pharmacies, and the moment they opened the market, pharmacies were popping up everywhere. Look in the US, I mean, you have CVS and Walgreens everywhere. I mean, you would wish actually that there are less of them. So that about like, I think it's a good and really strong argument, because we have like empirical data on it showing pharmacies actually, if you deregulate the pharmacy market, what usually happens is actually that more pharmacies are popping up. It might be that some go out of business because they were lousy pharmacists and they're not protected anymore, but that's creative destruction. That's in the interest of the consumer and the patient, because that also saves inefficiencies. So my favorite example, I think it's the best example in the world, is the Republic of Georgia. Southern Caucasus, since 2003, 2004, Georgia underwent a lot of free market reforms. I mean, they went pretty far, like with the back then economic minister Haka Bengduidze. He cut the taxes everywhere. He privatized almost everything. They were at least considering to privatize the parliamentary building and make a shopping mall out of it, because they moved the capital somewhere in the middle of nowhere to get like away from the politicians. They sold all the nice buildings where ministries were in and put them in some functional cheap buildings. And they also started reforming the health system, especially starting from 2007, 2008. So Georgia had this typical Soviet health system where everything is run by the government, funded through the general budget, and hospitals are owned by the government, not by doctors. So Georgia started to privatize all hospitals. I think within 2 years they sold all hospitals in the country, and they also privatized the insurance. So what they did actually is they abolished the state insurance, and they introduced a program for the poorest of the country, the 10 lari program, which is like $5. So basically, poor people got vouchers to purchase their private insurance from private insurance companies. So a basic benefit package. Not too much. It's like basically per insured, it's $5 per month, which is not too much in health insurance. But the Georgian government said, okay, we issue these vouchers and you can go to an insurance company and get your insurance. At the same time, Georgia needed a lot of investment for the health system, and the hospitals were really old, run down. Georgia's a very poor country. I think currently they might have $4,500 GDP per capita purchase power parity. Okay, I mean, it's like really poor. Maybe it's $5,000 now, but it's a poor country. So they don't have much money to actually renew the health system. So what the Georgian government said, okay, the insurance companies, since we actually give you this market now, we have like one condition you have to build hospitals. And you can either sell these hospitals after you build them, or you run them yourself. So you're insurance and hospital order. So you're more like a health maintenance organization, like for instance Kaiser in the US, something similar, but like for profit. And there were like 5 insurance companies which said, oh, that's actually interesting. Georgia's a country with 4.5 million people, so 5 insurance companies actually like kind of a lot. So these insurance companies started building hospitals all around the country. I think 80 hospitals, or almost 100 hospitals, but these are usually like small polyclinics with 25 beds, were built all around the country. And different companies so basically healthcare was totally deregulated, the whole health system. There were no prices dictated by the government. They said, okay, you have to find your prices yourself. People buy insurance and you have to figure out what you negotiate with the hospitals in terms of how much patients have to pay, how much the insurance has to pay. That should happen on the market. we don't know how the whole health system should look like. It's an experiment. So they did not regulate this, and the government did also not regulate how the payer and provider side has to be structured. You know, most countries, they say the hospital system has to look like this, and the insurance system has to look like this, and we regulate the insurances heavily. In Georgia, they said, no, we don't want to regulate this. We're not even sure if there's one insurance side and one provider side. Maybe it's the same thing. So different companies started out different models. Some were like classical, just indemnity insurance. We only pay, you send us the claim and we pay for it, and you go to a hospital and we don't even interact with the hospital. They have like their own price. Others were, no, we like provide everything. We want to have the entire healthcare value chain in our company. So there's, for instance, one company, it's a health insurance. It's a hospital chain, it's a pharmacy chain, and they are also a pharmaceutical they produce pharmaceuticals. So it's the entire value chain in one thing. I'm not sure if it's the best idea, but it's an interesting experiment. It hasn't been seen anywhere else before. I mean, in state-owned ways, but then you usually do not leverage the synergies of having the entire value chain in one. So in one organization. So like various business models emerged within a couple of months. And people were trying out, like, what's the best way? And insurances also went bankrupt. The two insurances went bankrupt. But basically what happened is the moment insurance declares bankruptcy, all the other existing insurances are fighting immediately to get all the patients being insured in that company because it's about market share. So it's not that they're like, oh, my insurance went bankrupt and now I don't have coverage. It's like, all the other players are like, we have to get their patients or assured. We need to have them immediately because that's market share. If we can get 10% more market share overnight, a 10% point of the market, then we have to do this. And twice it happened, basically, they were almost killing each other to take over these bankrupt insurances because they were like, oh, this is like, we need to get these patients. This is like the #2 insurance of the country went bankrupt. Like everyone would say, oh, that's a disaster. No, it was not. Like overnight was taken care of by the market. So this nightmare that, oh, if you only have a private health system insurance go bankrupt, then what happens with the patient? Yeah, other insurances will take care of them. And Georgia is like not the most sophisticated country in the world where everyone has MBAs and knows how to run these businesses. It was an experiment for most people. They were like doctors just trying it out. Some people which had nothing to do with healthcare before but were in banking. And they even found like solutions which are a gazillion times more sophisticated than in our regulated Western health systems. So really interesting in this voucher system, I think, is like a very good compromise. You could, of course, say we want to have totally unregulated healthcare and philanthropy should do it. But there's also realpolitik. So I think it would be very infeasible or not feasible to offer like a system where just philanthropy takes care of those which cannot afford insurance. Maybe in a world where we are like all more sophisticated and understand that we should all give to the poor because it's something good and we don't want to have social unrest and and we're just good people and philanthropists, it's possible. But in a country with $4,500 GDP per capita and rural population of 75%, which is like self-sustaining with like some mini farming or micro farming, such solutions might not be the most viable ones. So I think with this voucher system, 10 Lari program, they did really smart steps. So what happened, basically the result of Georgia was like more than 100 inpatient units were built by the private sector. No public money was used for that. And what also happened is that the corruption in the system totally got eliminated. I have to tell you this anecdote before my time ran out. So I was sitting down together with like, I had a client. He was from a big American health insurance. And they were interested in buying a health insurance in Georgia. Insurance which had like a similar model in them. They did like Medicare, Medicaid state programs in the US. Which is the state one, Medicare or Medicaid? Both are state? No, isn't one like, okay. So like they do like programs in the Midwest, public listed companies, I think $10 billion turnover. And they wanted to buy something in Georgia, and my job was like to find them like a target. So I did some due diligence, and we met up with a couple of CEOs of health insurance companies. So we meet this one CEO of this health insurance, and they also own hospitals in the regions, like in Kakheti, very nice wine region, close to the Dagestan border. And we have dinner, and he tells us the story of the moment he bought these hospitals in this Kakheti region. Nurses went on strike. There was this huge nurse strike in his company. And he drove to the region and met with the nurses and said, like, why are you on strike? After buying the hospitals where you work at, I tripled your salaries from $80 to $240 per month. Why are you on strike? And they were like, yeah, but we don't get informal payments anymore. It was much better. We got it like every day. So we didn't run out of money like during the months, because we get like every day a couple of dollars from the patient. That's like liquidity management wise, it's much better because we don't have to take care of this. And like, I mean, we got much more back then. And he was like, oh, shall I quote you on that? And the strike was like the solve. I mean, it was like, they were just like, okay, maybe it's not so good to be on strike with that argument. So, I mean, if you have private ownership and you have shareholders owning this hospital, they're interested that every cent which is spent in that hospital goes into the pockets of the shareholders or of the company and not of some corrupt employees. So corruption was wiped out basically overnight. I mean, there's still a little corruption, but it's basically, I mean, it's marginal in Georgia. What actually also happened to the costs per treatment. The cost per treatment in Georgia went down for about, so they went, basically nowadays, the cost of treatment are 40% of what they used to be when they had the heavily regulated state system, because the informal payments disappeared. And you have to calculate also the informal payments into the cost of state-run health systems, because that's actually what people pay. And that's why often people actually in state-run health systems cannot afford to get treatment. I think with that, I can just stop, because I think my time is almost, I've run out of time. But Georgia is like a fantastic example on actually what spontaneous order does. I mean, I studied health economics at university, I had really smart professors, but the stuff which developed in Georgia is like when no one studied health economics, the stuff which happened over 2 years was like more sophisticated than we all could have, like all my textbooks were talking about and how to structure healthcare. So great example. Now they have like a new government in Georgia, which is not such a big fan of free markets. So we have to see if this system actually survives, because they're like kind of like some old Soviet apparatchiks now running the Ministry of Health. The new Minister of Health studied in East Germany medicine, and he has a bit different idea of how to allocate resources and how to understand markets or to understand markets at all. But so far, the Georgian health system, I think it's one of the greatest miracles in free market healthcare, and it's an example. Much more research has to be done on, because I think the only big publication on it has been done by Oxfam. How evil it is, and it's like has lousy quality. I mean, I think someone, I don't know, with a degree in history of art or something probably wrote that. But Georgia is great. Other good examples exist. In Poland, there is privatization. Slovakia is a kind of decent example for improvement of healthcare. So the direction in Eastern Europe is bringing healthcare into more market-based systems and not the other way, especially the US and other European countries, Western European countries are marching towards. Thank you very much.
Thank you very much. It is a very special and very great pleasure for me to introduce our next speaker.